so we're gonna go ahead and get ready to insert the NG tube. Again, when it's time for you to swallow, I'm gonna just have you swallow.
Okay.
All right. And please let me know at any point if you need me to stop. Okay, so I'm gonna have this kind of parallel to go clear back. 1, 2, 3. Swallow, 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 swallow. Okay. We are stopped right here. I'm at my point. I got this. Now, when you place this, you want to have it placed like this on the nose. You want to kind of have a good visual of where on the nerve you want it. And then it's always a good idea to kind of have it peeled. But now that I have it pretty secured, holding on this with this, I can peel this back. I should have done that first. Okay, so now I have it secured. And the next piece would be to connect to suction. Now, patient didn't have any respiratory distress when I was doing that. If I did see any sort of respiratory distress at any point, I would have stopped and aborted the procedure and pulled the tube out. Now, because the patient tolerated it and I was able to advance the tube to my mark, I'm going to assume at this point that it's in the appropriate place and that it is in the stomach. So with that, I'm gonna go ahead and I'm gonna connect it to the suction and see if I get any gastric secretions back. So I am gonna go ahead and grab my little doodah that I saved. So I can connect. Then just kind of having a good landmark as to where I want to be to kind of tape this on to the patient's gown. You can kind of do this if you prefer, or you would do it on this side. I would probably put it on the side where I have it in the nair, just simply because it just makes more sense to have it on this side. Pull that. And this will just help with decrease the weight from the tube itself for the patient. Okay. I'll just turn on our suction. Now the suction has to be set for intermittent, and with that, it's supposed to be low. And when it's set for that, you should be able to have it in the green section, and it should be ordered. And essentially, at this point, I would be assessing to see if I have any gastric secretions coming up. Now, with regards to that, these are disposable, these aren't. So best practice, and also to save on supplies, would be to even just use, you can use this tape even. And you can just tape on here when you're doing your output. And say the patient put out like 300, you could tape and you can just put here, you know, at the end of your shift, date, time, initial, and then the next nurse coming on board, they'll kind of know where they're at, left off, and they can do the same. Of course, you don't want to get like way beyond a point that's unreasonable to manage, but this is always a good method of doing that, especially if they're only putting out just little amounts, because you don't want to be wasteful and changing those out continuously. And then the other piece is that always make sure you have the yanker ready to go and at the bedside. So I don't know if you noticed that that's something that I had here, even with the suction tubing just kind of ready to go, because my patient had difficulty with nausea, vomiting. So if at any point my patient was starting to vomit, I may have to abort the situation, but possibly use an oral suction if needed.